Mr. Speaker, my question is to the Minister of Health and Long-Term Care. Minister, family health teams across the province are losing their qualified staff and finding it difficult to find replacements. These teams, which provide valuable service in rural Ontario, are watching their staff leave to work in hospitals, CCACs, and long-term care, where compensation and benefits are better. What is your plan to ensure family health teams have enough staff to care for our communities?
Thank you. Minister of Health, Long-Term Care.
Well, Mr. Speaker, first of all, I'm very proud of the work that all our frontline healthcare workers do across this province. They are there often and generally when people are in their greatest moment of need, and they provide a vital and important service. Now, it's important when we look at our healthcare resource challenge, Mr. Speaker, that we understand that there are from time to time issues of recruitment and retention, and as a ministry we're working hard to address those specific sectors within our healthcare system. A perfect example, I think, was earlier this year when we made the announcement. We've now implemented it for our PSWs, or personal support workers, where we will be increasing by $4 over the next 3 years to make sure that we're helping to attract the right people to that important profession, Mr. Speaker, but also that the ability to recruit and also sustain and maintain them, particularly in the home and community environment, that is a viable option. And so, certainly, as we look at all the healthcare sectors, we will continue to take that approach.
Thank you. Supplementary.
Thank you, Mr. Speaker. Well, while family health teams are provided funding to hire frontline care staff, they are unable to fill the positions. There is currently a 20% vacancy rate in nurse practitioner positions within our family health teams. So when these positions are left vacant, how are these teams supposed to provide the services people need? So, Minister, again, what is your plan to address this growing recruitment and retention? And it is a crisis.
Minister.
Well, Mr. Speaker, our plan certainly isn't. In fact, it's the opposite of what the opposition's plan was in the 1990s, when they fired more than 6,000 nurses in this province. And in fact, since we came into office, Mr. Speaker, more than 24,000 nurses have been added to this province to help provide health care to people at the front lines. And just for our RNs, more than 10,000 RNs. I met recently with our nurse practitioners a couple of weeks ago, Mr. Speaker. They have indicated that they want to work together on the issue of recruitment and retention. We know that there are challenges in certain parts of the province. We have, I would say, led the way for Canada in terms of the construct of the nurse practitioner-led clinic. We now have 25 of them around the province, Mr. Speaker, and we will continue to work with our nurse practitioners, as with all nurses, to make sure that they are able to find those jobs and stay in those jobs successfully.
Thank you. New question. Member for